Majina yangu ni Johnston Rumasi, natoka kijiji hii Okimaru, Mwalia sublocation. Kazi ambayo nafanya mimi ni community health volunteer. Vile vile nafanya na watu wa Mari Stops kumobilize wamama sana sana ndio upenda mambo ya pangaji usasi.
Niliamua kufanya family planning. Kulea watoto na kazi ya shamba pamoja ni ngumu, kwa sababu huyu akigonjeka huyu hapa nalia. Mzee wangu alikuwa anafanya hospitali, akaniambia kuna wazungu wanakuja ya Mari Stop, pia twende huko tusikize vile itakuwa. Akatusanya sisi wamama wengi hapa tukaenda. Wakatupea advice na madaktari malakisi wa Mari Stop. Nikaona heri niingie hiyo kwa sababu miaka 5 sio ni muda mrefu kuliko hii ya miezi 3 Miezi 3 inaweza kuwa imefika umesahau, unashtukia unashika mimba nyingine.
Mari Stops Kenya supported us from 2019 with that training. Particularly what was a challenge to us in Kimilili was IUD insertion. We didn't have the skill, including myself. So that the staff were trained in IUD insertion and they've been being supervised by a team from Mari Stops. So we were taken through several sessions on emergency management, including PPH, anaphylaxis, that we are also prepared for whatever comes in our facilities.
The training was about medical emergency management and infection prevention. The second training was about long-acting reversible contraceptives, which includes implants, insertion, implant removal, and the IUD insertion and removal.
The SFF project in full name is Swiss Family Foundation, a project which started in the year 2020 April for 3 years, and it just ended in March 2023 with the main objective of partnership with the Ministry of Health to make sure the quality services are offered in marginalized and very hard to reach areas. So we worked in 2 different modalities. The first one is to ensure the supply chain was addressed, to make sure the providers whom we work with, they are trained, the community which is there is aware the services are offered in those facilities. Then to ensure the clients receive the service, we recruited the facility or we onboarded the government facilities whereby mostly they are from level 3 to level 5. So our main aim was to build their skills so that they can see family planning as a choice of the service rather than them only concentrating with the curative services.
Mari Stops together with other partners came together and partnered with the Ministry of Health through the Division of Reproductive and Maternal Health and supported in development of the training packages for the participant manual, for the trainers manual, PAC guidelines, CIP for PAC, and also all introduction of the trainings and PAC services in all 47 counties.
Before the training, I was not able to insert an IUD successfully. And what I have discovered is that the knowledge I gained from college wasn't enough. We just used to insert IUD. Then after a while, majority of the clients were coming back complaining of infection, like maybe discharge or whatever. But after the training, that is when I learned. Tulisoma pia counseling, pia confidentiality ya mgonjwa ikaingilia ndani.
So for the sub-county hospital, many times we have lacked non-farms. When we went to Nairobi for the training last time, we didn't know about endozyme. We were using JIC. So endozyme is better because it does not corrode the instruments. So we switched from JIC to endozyme first from Mari Stops, giving us this endozyme. They have given us implant removal and insertion sets. I've had the IUD sets, fully packed with the drapes. So the clients have increased from the 4 that we were seeing before January 2020. We are seeing up to 20 clients in a day.
So as Mari Stops Kenya, then we work closely with the Ministry of Health, number 1, to ensure that we reduce on the number of unmet needs. The other thing that we do closely with the Ministry of Health is to ensure that commodities are available. So we work with UNFPA to source for these commodities, but then UNFPA then channels those commodities to the Ministry of Health, and as Mari Stops, we're able to access those commodities and provide service within the public sector outlets that we work in the different counties that we work in.
When we partner with Mari Stops, the work becomes easier. And remember, Mari Stops also has technical personnel who support us technically during the development of the training manuals, policies. So It makes the work easier, partnering. It also becomes accessible because their support also goes up to going down to the counties to provide services, for example, outreach, inreach. So that one makes it easier to reach a client that you could not have reached as a ministry because they go up to the last mile.
IUD still has issues. That's why we're using community mobilization. They have meets, so it will go to the heart, it will go where. So we are having few numbers, but compared to where we were at zero. Yeah.
Mobilizing challenges ni inaekuanga sana sana wazazi wengine hawajachangamkia mambo ya family planning. Wanasema kwamba labda mama akienda family atapata cancer, lakini tunawaambia hapana, kama there is such a challenge, tunarudi tu kwa health facility, unasaidiwa, unaelekeza.
I would tell them that family planning is safe and it's helping us grow.
I can say within the project drive, we have managed to deliver more than 346 permanent methods in the counties of operation. An example for Bungoma, out of those 346, 56 of the permanent method came from there. And also the vasectomy, we had 6 cases in Bungoma. And also out of these numbers, 11% of the client whom we served, they fall within the age of 15 to 19 years.
Maybe what I can say, MSK has really helped us. Before that, nilikuwa nikiona kila ndio IUD like you just want to meander, then you say mwenye anajua kuweka is not around.
There are wonderful people because they have put us from some level. So we are very appreciative of the Maristons.
Through my personal experience, wanaume wenzangu, hii mradi ya Maristops ni muhimu sana. Ukiniona mimi mwenyewe nina afya nzuri but sina kazi yenye nafanya ya maana, that means you will have time mama na kulinda, wewe pia unalinda mama.
The ministry position is let all people who need to use family planning and contraceptives for our girls can walk anytime in a health facility and be given a family planning method of their choice.
Our advice is very simple. Your reproductive health is your responsibility, and it's a right within the Constitution. So anytime you want quality, comprehensive, affordable and client-centered reproductive health care, kindly walk into any Maristops facility and we will be able to give you that service.